Hello there, you're watching the press preview, a first look at what's on the front pages as they arrive in. In the next half hour, we'll have a look at what's making the headlines with three great guests, the Observer's Sonia Sodha, the Mail on Sunday's Harry Cole, and the freelance political journalist Isabel Oakeshott. So let's have a look first at what's on from some of those front pages, shall we? The Eye leads with the news that Boris Johnson has left intensive care, but is unlikely to be back at work in the near future. The Telegraph describes the Prime Minister as being in extremely good spirits, and The Times says he's at an early stage in his recovery. The same story on The Express. Their headline is Boris is out of danger. Likewise, The Sun says Boris is out, and The Mirror urges readers to stay inside and describes the Easter weekend as make or break. The Mail is upset with the Community Secretary Robert Jenrick for allegedly flouting the lockdown. He says he was visiting his elderly parents to deliver essential supplies and medicines and didn't go in to see them. Nearly 1,000 people in care homes have died from COVID-19, but their deaths aren't part of the official figures. That story is according to The Guardian. And finally, The Star criticises the Chief Constable of Northamptonshire Police for saying the public could have their shopping trolleys searched. So, Sonia, Harry and Isabel are standing by in their living rooms waiting to chat to us and our new socially distanced paper reviews. Thank you very much for being with us this evening. One story on many newspapers this morning, and that's the news that Boris Johnson's been moved from the ICU out of the intensive care bed. The Daily Express has got it on their front page. Their headline there, Boris out of danger. He's in very good spirits after signs of recovery. Isabel Oakeshott, let's go to you first on this story, shall we?
So almost all the papers have this on the front tomorrow. Not surprisingly, a huge relief, whatever your politics. Nobody really can support the idea of the Prime Minister being in such a very desperate position as to be in intensive care. The papers are all at pains to point out that he's in very good spirits, as he has been apparently throughout this. We were being told that he was in good spirits even when he was in intensive care, which I found slightly odd. Mostly when you're in intensive care, you're in a very, very bad way, and it's quite hard to keep your spirits up. And I think what's going to be a big challenge for him in the coming days and weeks is taking it easy enough to make a full recovery. It's very, very difficult for any senior politician to stand back, but for the Prime Minister to effectively take a back seat once he's out of danger is going to be particularly challenging.
Thanks, Isabel. Certainly like a great news for many people waiting to see Boris Johnson recover from coronavirus. How much of a shock do you think it was to people, Sonia Sodha, when he did first go into intensive care?
I think it was a huge shock. I think to see the leader of your country be taken into hospital, first of all, and then intensive care, I think it certainly really shook me up. I think it shook a lot of people up, actually. So I think it is there'll be a lot of people who will be relieved that the Prime Minister is kind of out of the danger zone. A real question, which a lot of the papers are focusing on, is, when he will go back to work. And I hope that he will take the time that he needs to recover. There was some suggestion today. Priti Patel gave her first interview in a while, and she was saying that the Prime Minister was appearing quite ill on some of the phone calls he was doing while he was working last week, which I thought was kind of interesting that she revealed that. So you've got to hope that the Prime Minister will take the time that he needs to recover properly. And it's completely understandable, of course, that this story is all over the front pages. But I think one thing that has been sort of pushed off a bit is, we had a death toll of 881 today, huge numbers, total death toll of almost 8,000 from coronavirus. So things are really still quite bad, although hopefully it will start to turn.
Yeah, it's a pretty staggering death toll, isn't it, certainly? And it's on a lot of the front pages. We can just have a quick look at some of the other ways the newspapers have covered it. This is The Eye. Prime Minister leaves intensive care and starts a long recovery there, emphasised by The Eye. This is The Times. The Prime Minister leaves intensive care to begin virus recovery. That's the front page of The Times too, and it's also on the front page of The Sun. Boris is out. Now, that really is a Good Friday, and they've got that picture of him, the last time he was seen in public clapping the NHS workers last Thursday, so a full week ago today. Harry Cole, what do you make of the coverage of Boris Johnson?
Yeah, well, it sums up a sort of national collective sigh of relief. I think the Sun, as ever, pretty much on the money with where people are. Is a great moment. Leaving aside the astonishing sort of constitutional and political moment the country was in for the last week, we haven't really, for a very, very long time, been in a scenario or known we've been in a scenario anything like it. You have to go back way to the 1950s before Prime Minister's health is such a key issue. However, in the day-to-day realities of this story, I think this moment has been twofold, really, for waking up the public consciousness about coronavirus. One, in the fact that it can strike anybody. This disease can hit anyone. But on the other hand, I think the other message I think some of the papers sort of pick up tonight is that actually you can go into hospital with this, you can go into intensive care, and you can get out and survive. So I think they should hopefully play up that particular angle in the coming days, because frankly, we need some hope in these pretty dark times.
Yeah, it does feel like any good news at the minute is certainly welcome. We haven't had much of it around today. Another story that I know that we're all quite keen to talk about as well is on the front page of The Guardian. The headline here is "Hundreds dying of virus in care homes, not counted in official data." It does feel quite an important story here, that an industry body estimating nearly 1,000 victims not recorded because they're dying in care homes rather than hospitals. Isabel Oakeshott, do you think this means that, we should have a certain amount of scepticism about the figures that we're getting through?
I think we absolutely should have a certain amount of scepticism. The figures are very confusing. As Sonia mentioned earlier, the latest death tally is, of course, horrendous, but is really only part of the story. There is this sort of forgotten situation in care homes where they're not being entered into all of the data. And at the same time, there are a lot of people whose deaths are being recorded as linked to coronavirus, when in fact they died with it, not of it. And in fact, some of the papers are now beginning to describe deaths of people with coronavirus. And that does mean that they probably had something else and may well have passed away in any case. And I think the situation in care homes is truly desperate. And I'm so glad that The Guardian has gone big on this, because there are so many people suffering in care homes. The care homes themselves, they've lost a lot of their staff. They're either self-isolating or they're unable to come in for whatever reason because somebody at home has shown symptoms of the disease. So care homes are really struggling for workers, and they do at the best of times. There's already a recruitment crisis in care homes. And then you've got these elderly people who are cut off from their families in a really brutal way, brutal on both sides. And there's a real tragedy unfolding here.
It's an important point there about being cut off from families, because, of course, the advice not to visit care homes, desperately sad for people who are very vulnerable. Sonia Sodha, how important do you think this story is?
Well, I completely agree with Isabel, and what we know from what's going on in care homes is that the industry body that The Guardian spoke to also estimated that half of care settings, they think up to half, may be affected with coronavirus infections, which is a huge number. And when you think about the way that care homes are set up, if one resident gets sick and then passes it on to staff, or if a staff member brings it into the care home, it's very hard to stop that spreading. And in care homes where this has been a problem, we know what they're doing is they're being forced to sort of isolate older people in their own rooms. Now, that's incredibly scary. Lots of care home residents have dementia, and it's obviously for their own good that staff are having to do this, but you have to keep explaining to residents again and again why they're being kept in their own rooms when normally they'd be socialising each other. So it's really quite a desperate situation, I think, as Isabel said. And I think that, there's been so much focus on the NHS, and there has been some reporting of what's going on in care homes, but really I think much less focus, and there's been less focus on the personal protective equipment that care home workers don't have. And I think it really does reflect that care has tended to be a Cinderella service to the NHS. Loads of carers, they're risking their lives every day going to care for older people that they've cared for many months or years. They're very scared about taking the virus into care homes. They don't have the right protective equipment, and they're being paid, they're often on minimum wage jobs. So I really hope that coming out of this crisis, we will will take stock of how we value care work in society.
Yeah, some really important points there. Harry Cole, do you think there's a wider point here about how we can trust the data? The Guardian flagging that many people in care homes not being included in the official figures. We're getting different numbers from the ONS, from the NHS. We're getting lags in reporting, so it's not necessarily the right number of people who've died in the past 24 hours. Can we actually trust the daily death tolls that we're getting?
The Boris and the boffins, as they say, those press conferences with the scientific experts, they do put quite a big health warning on the numbers as it stands, in the fact that this is actually very hard. You do have the ONS who are now recording deaths outside of hospitals. It does take time to collate the numbers from hospitals, because they like to let members of families notify members of families before they formally declare someone has passed away. So it is tough. However, what they do say is, well, don't get hung up each day on the exact number, because that does get adjusted throughout the week, and there are lags. They say, but look at the trends. And tonight, and yesterday, really, for the first time in this awful crisis, we're beginning to see some sign of hope that curve is beginning to flatten. So the advice from Balance & Co is don't get hung up on the individual daily numbers, but look at the wider picture over a course of a week or 2 weeks.
And the point, of course, as well, that there's a lag between the death numbers coming down and the infection rates coming down, the number of people in those intensive care beds coming down too. Thank you all for a lively first half of the paper review. We'll be coming back to you again shortly. Coming up, though, we'll be having a look at the growing calls for an exit strategy from the lockdown. That story there in the Times. We'll be talking about it when we come back in just a few moments. Welcome back. You're watching the press preview. With us now are Sonia Sodha, Harry Cole and Isabel Oakeshott, having a quick look at what's in the front pages and the inside pages as well of tomorrow's newspapers. And for our next story, we're diving inside the Times to have a look at a story questioning whether or not the government's got an exit strategy from the lockdown. The headline there, demand grows for an exit strategy with 90% of people still virus-free. That's picking out the statistic from the news conference earlier, where the advisor to the government said that they believe less than 10% of the population has actually had the virus. Let's go first to Harry Cole, shall we, on this. How much pressure do you think the government is under to provide at least a way out of the lockdown, even if it can't be enacted yet?
Huge, and there's a very live discussion going on in the heart of government. On the one hand, you've got the Department of Health, who are very keen to see this lockdown extended for as long as possible, and following the science, meticulously to following the data before any discussion of lifting it could possibly be countenanced. Then on the other side, you've got the Treasury, who are saying, hold on a second, it's all very well having a lockdown, but there's got to be a country to lift out of it. By the end of it, there's got to be a country, there's got to be an economy. And then you've got another sort of counter argument in the middle of we're not actually seeing the whole balance sheet, so to speak. You've the wider long-term implications of a long lockdown and the long economic downturn that will trigger may result ultimately in a year's time or 2 years' time or 3 years' time with more deaths than the virus was ever given the country, due to suicide, due to alcoholism, through all sorts of ranges of studies have shown that economic downturns do cause a spike in death rates. So this argument is going on all the while that Boris Johnson is slightly incapacitated and out of it. You've got government departments sort of jockeying for the right course of action, and top of Boris's in tray when he does finally return to work is making a decision on which way they go. How do we do that? And that's a tough call that I wouldn't want to make myself.
I guess the difficulty as well is this risk that if you lift the restrictions, then the virus just comes back, unless you've got a vaccine, which feels like it's 18 months away, or testing. Yeah. And we're, of course, way down the list when it comes to the number of tests that we're carrying out. Isabel Oakeshott, do you see any way out at the minute that could let us return to normal?
Well, clearly waiting for a vaccine, unless there's some kind of incredible miracle, isn't going to be an option. And as Harry was saying, what is going on at the moment behind the scenes in government is this awful wrestling with the reality that, you know, as every day goes by, the economic consequences get worse. And that isn't just some kind of distant thing that only matters in terms of the bottom line in people's how much money they have in their pockets. It's a real human thing here. There have been some research by academics which have suggested as many as 150,000 avoidable deaths may be linked to the economic consequences of this lockdown in this country alone. The very, very powerful evidence over the health consequences of poverty and alcoholism and so on. So there's a really, really difficult judgment to be made here. Fortunately for the government, the public at this point are overwhelmingly on side with the lockdown. So the pressure is coming not actually at this point from voters, as it were. It is within government, and that knowledge that with every day that goes past, there is a price to pay of a different type.
Sonia Sodha, I can see you keen to come in as well.
Yeah, so I mean, I think obviously the ultimate exit strategy is a vaccine, but that's a 12 to 18 month wait minimum. There are two other things though. There's first of all treatment and making sure that there's adequate investment globally in treatments of COVID-19. And there are some quite exciting trials going on, but we need to make sure that there's global cooperation on that there's enough money going in internationally to trials of new drugs, because that could really reduce the number of people having to go into hospital or intensive care. So make a huge difference. So there may be some light in the next kind of 6 to 12 months on that. And then the other thing that's really important is testing and contact tracing. And that is the way to loosen restrictions around what we're all able to do while still trying to keep a lid on the virus and keeping it manageable for the NHS. And in order to be able to do testing and contact tracing, you need some of the things that they've got in a country like South Korea. And I think there are real questions for government. If you look back what's happened over the last 6 weeks, it doesn't feel like government were taking timely decisions around procurement of ventilators. That came far too late in the process, or procurement of testing capacity like Germany did from a very early point. And so I think, you know, that's not about sort of criticising the government for criticising the government's sake. It's about looking forward and making sure that the government isn't making the same mistakes going forward. And, you know, we know there are big efforts going around in testing, but I think really there's got to be a huge focus. There isn't going to be an exit strategy unless we have
Thank you
more money.
very much for a very interesting paper review. Lots of subjects covered there. Thank you all three. Lots coming up, of course, after this short break on Sky News.